What is the approval process for osteoarthritis joint replacements? If you are curious about how joint replacements for osteoarthritis get approved, you are in the right place. Let's break down the steps involved in this important process. The journey begins with manufacturers conducting laboratory and biomechanical testing on joint replacement devices. This testing assesses how durable and strong the devices are, as well as how well they work with the human body. For example, knee joint prostheses undergo specific tests to simulate the forces and where they will face once implanted. These tests help identify any potential risks and set safety standards. Once the initial testing is complete, the next step is to conduct clinical trials. These trials often compare the new implant to existing treatments or surgical procedures. The goal is to see how well the device improves pain, function, and quality of life for individuals with osteoarthritis. During these trials, researchers also monitor for any complications that may arise. A recent example includes a new implantable shock absorber for early-stage knee osteoarthritis, which was tested in a multi-center trial. This trial showed benefits in pain relief and function with fewer complications compared to traditional methods. After gathering enough data from these trials, manufacturers submit a pre-market notification to the U.S. Food and Drug Administration. This submission, often referred to as a 510(k) submission, includes all testing methods, results, acceptance criteria, and conclusions. The Food and Drug Administration then reviews this information to determine if the new device is substantially equivalent to a legally marketed device or if it meets special controls for safety and effectiveness. This review can lead to clearance or approval for clinical use. In some situations, there are accelerated approval pathways available. If osteoarthritis is recognized as a serious disease with unmet medical needs, this can speed up the process. Structural or surrogate endpoints, such as imaging biomarkers that predict clinical outcomes, can support approval. However, post-marketing studies are then required to confirm long-term benefits. From the perspective of treating osteoarthritis, this approval process ensures that joint replacements offered to patients have undergone thorough evaluation. This helps provide relief from pain and restore joint function when other therapies have not worked. It balances innovation in surgical interventions with patient safety, guiding decisions about when and how joint replacement surgery should be performed. For patients considering this option, it is essential to discuss with their healthcare provider whether joint replacement is appropriate based on symptom severity, functional limitations, and overall health status. Surgeons may also use advanced techniques, such as robotic-assisted arthroplasty, to improve the accuracy of implant placement and outcomes. Overall, the approval process for osteoarthritis joint replacements involves rigorous testing, clinical evaluation, regulatory review, and ongoing monitoring. This ensures that surgical interventions effectively address the joint damage and disability caused by osteoarthritis.